Right, I am Dr. West and today we will discuss another chest x-ray. So, can you spot abnormality in this x-ray? I give you 5 seconds. Right, I will give you a clue over here and then you will have to find a diagnosis. So, this x-ray is having a bat wing appearance. Right, this is bat wing appearance. You can see this one and bat like this. You have seen bat has wings like this one one wing and the second wing. So now can you guess the diagnosis? I have given you the biggest clue. That is pulmonary edema. Pulmonary edema is a classic clue for pulmonary edema is bat's wing. Bat's wing you can see on the chest x-ray. Bat wings is classic for pulmonary edema. So this is a classic x-ray for pulmonary edema. It can be due to cardiac reason or due to the lung pathology. For example, if a patient has a heart failure and mostly due to left-sided heart failure, you know, it results in the pulmonary edema, and in lung pathology, it can be due to RDS, respiratory distress syndrome, sepsis. It is also one of the common cause for the pulmonary edema, and pneumonia can also cause a pulmonary edema. So how you will find pulmonary edema, or you will assume a patient is having a pulmonary? For example, if a patient has a cardiac history, for example, he had a cardiac failure or he had a MI previously, so you will assume that he is having a pulmonary edema. And how the patient will present? Patient will present with shortness of breath, difficulty in breathing, and orthopnea also. And sometimes the patient will present with the frothy sputum that will be blood stained or pinkish in appearance. That will also indicate that patient is having a pulmonary edema. And the other cause will be whenever you auscultate, you will see crackles all over the lung. Crackle is also a sign that patient is having a pulmonary edema. So these are the that sign and symptoms that indicate that patient is having a pulmonary edema. So whenever you see crackles, and you always correlate, I always tell you that always correlate clinical finding with a chest x-ray. It will be very easy to diagnose a patient or to diagnose a disease like this one. So this patient presented to us with the shortness of breath and he was having a cardiac history 5 years back. He had MI and now he presented to us with shortness of breath and orthopnea. So when we did his chest x-ray, so this x-ray looked like this. So this is the x-ray of pulmonary edema because when we auscultated him, he was having crackles. So this is a classic x-ray of pulmonary edema. You can see the bat wing appearance. You can see bat wing appearance, bat like this one, bat this one. So this is classic. This is classic for pulmonary edema. As I've told you, it can be cardiac reason and it can be due to respiratory reason. As we are discussing respiratory section and we are continuing with our respiratory series, so we will mostly discuss the respiratory causes. When we will do a cardiac section CVS, then we will do the cardiac reason. So over here it can be due to respiratory distress syndrome, pneumonia or sepsis. Okay, right.